Welcome back to Yugo Health, where local stories meet public health in real life. Today we are pulling back the curtain on a crucial initiative that's all about protecting what matters most, our health, our families, and our future. Here in Umatilla County, we have been working alongside dedicated partners to strengthen our community's resiliency against preventable disease like pertussis or whooping cough.
Welcome to Yugo Health. I'm Paula Lamas, Communications Coordinator, and with me it's our talented and beautiful and smart Clinic Nursing Coordinator Supervisor, Lexi Fodor. Thank you for being with us because this is a very important issue. We are going to just pull the curtain to see how we are working with different partners and how we are straining our forces and joining forces to create a better community here in Umatilla County. So thank you for being with us today.
Yeah, thanks for having me. I'm excited to be here.
Of course. And we are going to develop, many people, they don't like to talk about what is happening behind campaigns, behind strategic plans and everything, but we are going to try to be as transparent as we can and explain a little bit about it. Could you share a bit about this helping campaign that we are trying to do with our partners, this helping effort to, provide the accurate information, the proper information about nature?
Yeah. So I've been working with the health department for 6 years, and over time, we've put out some messaging, tried to connect with our community, and we often just lack that, the tools behind how to get messaging out and what's the best way to communicate and connect with everybody on different platforms especially. And so with the help from NACCHO, we've been able to learn so many tools to help communicate effective messages, trusted messages, where to go for good information. So we have really tried to align what we're doing with NACCHO's platform, and we have received a lot of support from them to help us through this process.
Okay, one of the things we have been working behind curtains a lot about this,
yes.
and probably people didn't see it. It's just the final product, and sometimes it's this is what we are talking about.
Yes.
But little by little you will notice about this and what goes into planning a campaign. I know what was it, but I want you to share a little bit in an easy way so everybody will understand. They will understand a little bit about it. So what was that campaign to connect families, individuals, schools, and clinics, and align this message?
Yeah, so we often think, how can we bring the messages to our families, our individuals that we all care so much about in our community? And we really find that we need to bring the information to them to make it convenient, to decrease that burden of getting that trusted information. And so by us, gathering some information and publishing it on social media is super helpful, bringing education to schools, to families where the parents, you're busy, you don't have time to do all the research. So by bringing it to you at a convenient time where you're already doing some event with the school or some parent involvement with the school, and really partnering together to ensure that we're keeping, each other safe, our kids safe, our families safe. And we at the health department as well are always happy to take calls to go over vaccine records and really break down the recommendations and why they're recommended on certain schedules as well.
It is important because it is a topic that recently we have been seeing a lot in news and media, and a lot of things happening in social media, but we are trying to put together information from trusted sources. So we want to be your trusted sources here in our county. So whatever we are saying or referring, it's backed up with a lot of data and a lot of information. So I believe that is something very important to highlight at this point. And I want to ask you something else in a time of information overload, with all these things in TikTok, in Instagram, in Facebook, how do we make sure people have access to reliable, clear, and actionable health information?
You are right. It is information overload when you go to look anywhere. And so I think that, going to your local resources, like your local health department, the state health department is really helpful. As a parent too, I always rely on like immunize.org. They put out, information that's easy to read, simple, it's easy to understand. It is, you understand quickly why something's recommended. They go over the risks, the benefits of everything, all the vaccines. And so I think that's really helpful over time to look for those really patented resources that have been around for a long time.
We have been hearing about pertussis and measles a lot recently. Apparently, it's like cases surfacing in a region or close to us. What does that mean for our community here in Umatilla County?
Yeah, so even though, we might not have some of the illnesses in our county right now, they're definitely nearby. It's a very real threat, with pertussis especially, and then measles is very close by. And so we really need to look for that trusted information, immunize.org again, or what we put out on our platform. We, vet it through research and everything. And it's just really important to take care, like when you're traveling, everyone's traveling this summer, having fun, doing everything. And so even if your community that you're leaving from doesn't have an outbreak, it's good to know and look on those trusted websites to see if the community you're traveling to does have an outbreak. And that way okay, I need to check my vaccine record, am I up to date? And the health department is definitely happy to look up your vaccine record for you. If anyone's been born in Oregon, we probably have access to your record.
Which is easier.
Yes.
If not, that's the situation.
Yes. So we can help direct you if you were not born in Oregon on where to get your record from, but it can definitely be super helpful to look that up and know kind of how you are protected before you go.
How are local voices shaping, in a way or another one, Yuko Health and partners' design message materials and outreach efforts?
Yeah, so we are definitely collaborating with local partners, and we have started a new group called Community Champions, and it's been very exciting to get together about once a month so far and really dive deep into what our diverse community needs. We go over, communication platforms and information together and make sure that we all are on the, forefront with the same messaging and, fostering that collaborative relationship. And then we can all become a trusted source together as well.
So it's not just us, it's everybody that is, in a way or another one, surrounded us or working in the same field here in Umatilla County. So everybody will be aligned, mm-hmm. and also in the same way, everybody will participate and share their thoughts, or what they think, or what is the feedback mm-hmm. from the community, which is the most important thing.
Yes, so important. We really value everyone's feedback, however we get it.
Can you speak to how collaboration with schools, healthcare providers, community leaders amplify the impact on public health initiatives?
Mm-hmm. So collaboration to me between community partners, providers, whoever it is, getting together from the community is one of the most powerful tools that we have in public health. In order to get the messaging across the board, you really have to collaborate and work together. And so by doing that, we've been able to have some really positive feedback from the groups and individuals in our community, and to help guide what we are doing. Really, when we stand on that forefront together and we're like, okay, we're ready, we got to get this messaging out, this is important, this is what our community is dealing with right now, we can then become unified and really spread the positive messaging that we all need to hear.
What is one common misunderstanding about diseases prevention or vaccines that you often encounter, and how can we gently clarify it to our audience?
We often hear in the clinic working, that the illness is not around anymore, right? So why do we need to vaccinate? And that's really, we hear it all the time. Totally understandable statement as well. And really, illnesses and, vaccine preventable diseases, they are becoming more rare, some of them, and that's just due to over time we've been able to effectively vaccinate across the nation. And now, as time's gone by and we've been more protected and that alarm has gone down, we are creating kind of holes in the immunity process and that herd immunity you get from vaccines, which then allows those illnesses and diseases to come back. And so by, us vaccinating and vaccinating each other and our families, we're then helping those that actually can't get vaccinated, that don't even have that opportunity. So even infants, they're not always eligible for vaccines until they even hit a year old for measles. So by creating that herd immunity, we can help protect not just our own selves, but our families and our friends too.
And something that I want to highlight that probably people are thinking just, vaccinations, it's just back to school, it's just for September, October, whatever, but it's any time of the year. You don't have to wait to come back to school to get ready on those situations, to get updated with your cards and your kids. You have to do that everywhere, right?
Yeah. Any time of the year is great. I think it can be stressful going back to school for many kids and parents. So getting that done in the summertime before you even have to do the whole back to school thing and registration can be really helpful.
At this point, we are still following ACIP guidelines, right?
Yes, absolutely.
And what are some everyday actions families in Umatilla County can take to protect their loved ones and feel confident about their health decisions?
Yeah, so, just looking up, when you have a question, look it up through your trusted resource that you have. If you can always call the health department, we can talk about vaccine recommendations, the schedule, and everything and any question, around that. I think also just realizing where you're going, like I said, with travel is important with the summer travel time of the year and before holidays too, because a lot of people travel for the holidays. So really doing the research and say okay, if I'm going to another state, is there actually a measles outbreak occurring in the state right now? That's good to know. And then just everyday general vaccine, it doesn't have to be vaccine related, I guess. And so that could be washing your hands, covering your cough and your sneezes, staying home when you're sick. I know it's really awful to miss out on something so fun, but when you stay home when you're sick, the likelihood of you spreading it of some illness of any kind is always decreased.
Totally. And what do you hope people take from this campaign?
I really hope that from this campaign, people just realize that, we really are trying to come together as a community, and we're trying to put messaging out that is reliable, trusted, and hopefully easy to read and understand. And of course, if you have questions, please feel free to reach out. You're not alone. We're doing this together. We're all learning along the way as well. So we always value feedback over time. Please feel free to give us feedback at all.
So where people can go if they want or are curious to find out a little bit more about it?
Yeah. If you have any questions or want to learn more about anything that we're doing with our campaign, please feel free to reach out to us, Paula, Lexi at the health department. Comment, share on social media, please. And we're more than happy to go over questions that you might have.
Totally. And this is one of those topics that we want to share with you, with those facts, checks, with everything. We are going to go to every single source to provide the most accurate information to you, and not just like someone tells me or my neighbor says something or I find out some post in social media. So it's about what science says and what experts say. So it is important that also highlight that those vaccines for kids have been made since decades ago.
Yeah.
So like 1960 or so, right?
Yep.
So it's more life that they have been saving than anything else.
Yeah. We've had lots of time to figure it all out and, have those evidence-based recommendations.
You are not alone. So reach out to us if you have any questions, and thank you so much for your time.